extraordinary day at the office for Yvonne Felix. Extraordinary because if it weren't for the medical device she's wearing, she wouldn't be working here today.
I have something called Stargardt's disease, which is central vision loss. So I have a big blind spot that takes up 98% of my visual field.
For most of her life, a rare medical condition has meant a number of opportunities were simply not within reach for Yvonne. Although she is legally blind, with the help of a made-in-Canada medical device, Yvonne is now able to see and work. It all started 4 years ago.
I heard about these glasses that were going to help people with Stargardt's, my eye disease, and I didn't really believe that they would work.
This is footage that was captured on that fateful day Yvonne wore them home for the first time.
It was incredible. I was looking at my wedding pictures, and I was looking at, I saw my 6-year-old son for the first time too, and it's just, you can dream, but it's not the same. It's so much better.
Today, Yvonne works helping others with low vision raise funds so they too can benefit from this life-altering medical device.
I get to come and I get to be just like everybody else. I get to work full-time. I get to provide for my family. I get that option. I've gone back to school. I'm applying to do my MBA because I can.
The premise that we always talk about at MEDEC is the first thing is better patient outcomes.
Brian Lewis is the president and CEO of MEDEC.
You just don't take a look at the device, you look at the so what. And I think we have to look at what's the impact? What's the impact they've had on their lives?
MEDEC is the industry trade association for Canadian medical device companies, a dynamic industry that employs 35,000 people.
You see these patient stories and you're just wowed by the impact that it has on people. It really has brought the world forward.
Investing in medical devices that change people's lives and give them the ability to reach their full human potential is a fraction of the cost of what it will cost for the rest of their life supporting them.
Yvonne isn't the only person whose quality of life has been enhanced thanks to a cutting-edge medical device. McKenna Lumley may still be too young to work, but medical devices have given her nothing less than a new lease on life. McKenna's mother, Karen, explains.
In the winter of 2009, she started to have some flu-like symptoms. She kept having this waking up in the morning, throwing up, like 5 o'clock in the morning, throwing up.
That's when doctors suggested she have an MRI.
And
they gave me applesauce and told me I had to glow in the dark.
That's right, told you to glow in the dark. And we got a call at 5 o'clock that afternoon. They called and said, we've got an ambulance waiting for McKenna, and she's got a large brain tumor in her head, and we need to get it taken out right away.
McKenna was 4.5 at the time.
I only packed enough clothes for 3 days, so we weren't really thinking.
That was a problem.
Yeah, we weren't really thinking about it. She had surgery, and it was long. It was about 15 hours.
Another MRI was ordered post-surgery, and the medical team decided a second operation would be necessary.
We had these great healthcare professionals, and then they were able to choose stealth technology, and that they used this medical device that gave her an amazing outcome.
What happens to the patient at the end of the day is what's important in terms of bringing their life to a higher level of quality, to reduce the number of treatments or side effects that they may have, to allow them to return to society and interact in society and with their families.
If she lived in a country where they didn't have an MRI or couldn't have been able to diagnose it, they wouldn't have been able to detect what was wrong, the tumor would continue to grow, and McKenna wouldn't be sitting here now.
McKenna's treatment was a success, and she returned home with her family. But years later, another diagnosis. When she turned 8, her doctor ordered more images, this time of her back.
We got a call that said, the x-ray showed scoliosis. And when they pulled up the picture of her back on the screen, it was...
You said, this can't be it.
That's what I said. I said, this is not McKenna Lumley's back. And it was like a curved S spine.
But this hasn't stopped McKenna. Today she wears a custom brace most of the time and is an active, healthy little girl.
It's a win-win-win for everybody because it's a win for patients. It's a win for the healthcare system in terms of pressure on the system, and it creates an ecosystem for investment and growth of Canadian-based industries. We have to be part of the solution to the healthcare system.
When you kind of get funneled into this existence, The government is picking up the pieces for you and your family for the rest of your life. And I don't have to do that.
Instead, because of an extraordinary medical device, she gets to live her life one extraordinary day at a time.
It's almost invaluable because you've helped someone reach their full human potential.